All right. Welcome to Be Frank. I am Frank, right? And today we'll be talking with Kristen. Our topic is childhood abuse, understanding the signs, and how to find healing. After such a tragedy such as that. Kristen is a licensed professional counselor. Currently, she is serving clients at the Treehouse by District Counseling. She has a background in school counseling as well as an educator. And so, welcome, Kristen.
So I'm Kristen Trevino. I am from San Antonio. I went to Texas A&M, and so from there in that College Station area, I transitioned over to Cyprus when I got a
Mhm.
teaching job. And I was an educator for over 10 years, and I taught. I was a school counselor, and then now I'm here in the therapy world. So
What made you go into education initially back?
I think I've always wanted to be a teacher. I've always liked working with kids and
Mhm.
helping. It sounds corny because a lot of teachers will say this, but you set up your stuffed animals and you like teach them or you like tutor, and it was something that was natural.
Mhm.
So it just
Mhm.
kind of flowed in.
That's awesome. And
Yeah.
then you went into a school counselor role. So you made that
Yes.
transition and
Yes, I actually did this program called Capturing Kids' Hearts.
okay.
And that program is all about relationships with
Mm.
kids. And, one of their slogans is you can't get to the kid's mind without getting to their heart.
Mm. Oh, I love
So,
that. Yeah.
building upon that. And I noticed as I started to build relationships with
Mhm.
kids, that felt like that was more of my passion, helping
Mm.
them through personal um,
Yeah.
items. So,
For sure. And so
yeah.
then you stepped into the school counselor role.
Yeah.
And what was that experience sort of like? And how long did you do that for?
I think it was about 3 to 4 years.
Okay.
I loved it. I was at a school that was pretty challenging, and a
Mm,
lot of the kids were high needs, but
mm,
I learned a lot. There were times when I did have to stay late and make CPS calls or help families in need, but it was a blessing too to be able to help in that way. I had a nonprofit adopt our school,
mhm.
and they were able to help students get Christmas gifts.
Oh, that's awesome.
Yeah, so
That's
it was
really
nice
neat.
to see.
That's really neat. And then you
Mhm.
went into the clinical, right? To the community
Yeah.
now. And so that transition, what made you go then into, go from school setting to the community?
Yeah, as a school counselor, it feels like you're limited in a
Mm,
way because you can't take the full hour. It's not therapy.
mm,
It's more solution focused, and it felt after a while like it was a band-aid on a bullet hole. Like you can't help them any deeper. You have to refer out.
mm.
And that hurt my heart seeing these babies, I couldn't do more. So that made me feel like, okay, my next step is to be a licensed professional counselor and be someone out there for them.
That's amazing. Yeah.
Yeah.
And I admire your passion. I've known you now for is it about
I think
I think we're
so.
headed for
Yeah, and
3
this is our
years
first time in
now.
person.
Yeah. And for 3 years, I mean, you've done, so I can see the passion that you have, working at the children's center, right, at the
Yeah.
tree house, and just, you have a lot of love and care for the clients that you serve. And
Yes.
earlier ago, you mentioned about, having to report to CPS, and
Yeah.
that's the topic, right, of what we're going to be touching on today is child abuse, right?
Right.
And even saying it right now for me, it's there's a bit of a cringe,
Yeah, there's some tension.
yeah,
Yeah.
with that. And so, um, have you had to recently, make those sort of reports? Is that common? Is that something?
Yeah,
Yeah.
it is common, unfortunately. The most common type of abuse is neglect in the
Hmm.
state of Texas and nationwide.
Oh wow.
So neglect could mean that the kids aren't having their basic needs met, whether it's hygiene or medical
Hmm.
or dental. The local schools in our area do help with things
Hmm.
like that. And a lot of families aren't aware, but school counselors do try to promote that. They have
Okay.
what's called a youth service specialist, and
Hmm.
that will help families get those basic necessities that they need. So it is preventable.
Okay. So every school has these kind of
Yeah,
resources,
inside
and
fair at least. Yes,
okay,
yes. And the
okay.
youth service specialist,
Mm.
they're hired through the county, so through Harris County, and then they
Mhm.
just partner with the schools. So,
Okay,
yeah.
okay. And is that something that needs to be referred to, like, by the school counselor, or do
Yes,
and parents would I somebody has to say something, I'm
exactly.
assuming. Okay,
Yes, yes. So it's very important that teachers and the school counselor has the relationship with kids so that they feel comfortable coming
okay.
forward and sharing some of
Yeah,
those things,
for
you know.
sure. Okay, okay, that's interesting. And when it comes to the community setting, what
Hmm.
kind of abuse, I mean, have you had to, work with, or what have
Yeah.
you seen? Is there something more common than others, or
Yeah. So I've had to report all kinds of abuse, and
okay.
I think um the difficult one for me was
Mhm.
sexual abuse.
Yeah.
There's such a shame that comes with that for the kids, and
Mhm.
it's hard for them to recognize, like, this isn't my shame. It's not
Mm.
my fault.
Mm.
And it's also conflicting for them because most of the time in these cases, the abuse comes from a family member. So there's that conflict of like loyalty and safety, and they're
Yeah. And
confused.
that's where it gets difficult for them. It's knowing that it's a
Yeah.
family member, and
They feel
like
like there's some betrayal there. So,
okay, okay. So what's your process like? What is the basic kind of protocol when someone suspects that a child is being abused? And it
yeah.
might be, I don't know if it's different from a therapist versus a parent or
Right.
another individual. So
Yeah, yeah, for sure.
what does that
So,
look like? Yeah.
therapists in our world, we're mandated reporters.
Mhm.
So, if we suspect abuse, I think the timeline's 24 hours that you have
Mhm.
to report it. If it's an emergency situation, then we have to call 911.
Okay.
Um, for parents, I think first and foremost is be there for your child when they disclose abuse. We're not
Right.
going to rush to reporting right away. We're not going
Mhm.
to ask them why questions or investigative questions. We're going to show
Mhm.
them, I'm here for you. I'm
Yeah,
sorry you went through that. And just be supportive and
for
offer
sure.
emotional safety. Once that child feels comfortable
Yeah.
and they're okay, then we can go on to report. And
Mhm.
in Texas, we have the abuse hotline that
Okay.
parents can call.
Mhm.
But again, if it is an emergency, they would have to call 911.
Okay.
So,
At that point.
yeah,
Okay.
yeah,
Okay. Yeah. Are there any specific signs that, that we as parents should be looking for,
yes, yes. So definitely changes in behavior.
Okay.
If you notice that your kid is withdrawing,
Mhm.
maybe they're shutting down, maybe there's some aggression or maybe even regression. Um, I think those are definitely some important signs to look for. If they have any injuries to their body
Mhm.
and it's unexplained, we're not sure how they got it,
Mhm.
that's definitely a sign. The one that I feel like a lot of people miss or
Mhm.
mislabel is aggression.
Okay.
We tend to think, oh, well, they're not listening, they're being
Mhm.
defiant,
Mhm.
when really that's the child trying to communicate something's wrong.
Right. When we see these sort of symptoms, right, I,
Hmm.
I guess we wouldn't automatically assume like this child is
Yeah.
being abused. So, and I'm thinking like my own children, right?
Yeah.
Like if I start seeing some of those symptoms, right? So like how would I approach my child
Hmm.
with, how would I question that, or what would that kind of
Yeah.
look like?
Yeah, yeah, you're right. Not everything's gonna be
Hmm.
abuse. It could be other things. But either way, when we notice the change in
Hmm.
behavior, something's off and
Hmm.
parents should check in. So I think kids try to see parents' reactions too, and they'll test them a little bit,
Hmm.
but sometimes it goes over the parent's head.
Makes
So
sense.
I think just offering that safe place, normalizing feelings
Hmm.
in your household and just being there for them in
Yeah.
those small moments. So when it is big moments like that, they'll come to you and they'll talk to
Yeah.
you.
What is creating a safe space? Like, what does that look like? Is it that,
Yeah.
like, normalizing
Yeah,
feelings, or
exactly
what is
that.
that? Okay.
Yeah, exactly. We want to show kids that we're there for them in the small daily moments.
Yeah.
So when it's the big moments, it's almost natural. Like they want to come and tell you what's happening.
Right. Awesome.
Yeah.
Awesome. No, that makes a lot of sense for
Mm-hmm.
sure. Are there any questions that we should avoid as parents to ask,
Yes.
ask our kids? Yeah. Okay.
Definitely. And this one's a hard one because as a parent, when your child shares that,
Mm-hmm.
it's heartbreaking and you're a human and you want to react. but it's important that we avoid the why questions.
Mm.
Why can sound very accusatory.
Mhm.
It can sound like you're investigating, like you're blaming.
Right.
And so we just want to avoid that altogether, to show your child that you're calm for them, that you're
For
supportive,
sure.
and just thank them for having the courage to speak up.
Absolutely. Once someone makes an outcry, right, and
Mhm.
there's a investigation and it's determined, yes, there was
Yeah.
abuse, like what's the next step here? Like,
Yeah. Yeah. So with law enforcement, they have their own procedure.
mhm.
But as far as the parent, I would recommend starting them into therapy.
Okay.
And when they go to therapy, they're not going to have to share the abuse right then and
Right.
there.
I think that right there is what a lot of parents would worry about. It's like I don't want them to continue to talk about it, right? And so and I guess I'm trying to put myself in those shoes, like what that would look like. And it's I don't want to re-trigger or traumatize my child, having to be telling the story over and
Yeah.
over. And
No,
so
that's exactly right. So
yeah.
with therapy, the first few sessions are going to be
Hmm.
building rapport.
Okay.
And what that means is that you're establishing a safe
Hmm.
relationship with this child.
Hmm.
So we're getting to know them, they're getting to know us. And then from there, maybe we'll work on other things,
Yeah.
we'll work on their feelings, we'll work on school. And then as it comes up, when they feel that they can share with you, they will.
Okay.
And it'll be at their pace.
Gotcha.
Yeah.
So what does the therapy process look like? Is there specific modalities that are used,
Mhm.
or what does that look like?
Yeah, yeah. So the most common one is CBT,
Mm-hmm.
cognitive behavioral therapy, and that's all about reframing the negative thoughts.
Mm-hmm.
Another one that's used for trauma and for abuse is EMDR,
Okay.
and that'll help that negative belief system that's been instilled in that child.
Mm-hmm.
It'll help reprocess that memory
Mm-hmm.
so that they're able to function and they're not constantly reliving it in their minds.
EMDR is something that's become pretty popular in recent years, right? And so like, those individuals that are looking,
Yeah.
into EMDR, I mean, how do you explain that? Like what is EMDR?
Yeah.
What does that look like? And
Yeah, so when the trauma happens,
mhm.
even though it's past, it's over with, it's still in our minds and it's still playing. I like to imagine it kind of like a projector in the background playing a movie.
Okay.
So no matter what we're doing, there might be triggers, there might be some beliefs associated with it,
Mhm.
and that affects your relationships, your
Mhm.
friendships, your job, everything you
Mhm.
do. So
Mhm.
when we do EMDR, we're looking at what that present negative belief is. Is
Mhm.
it I am unlovable. I am
Mhm.
worthless. And
Mhm.
we're seeing how that connects in your present, your past, and how it'll be in your future.
Mhm.
So from there, we're thinking of, okay, well, what's the positive belief we want to have? And
Mhm.
in the installation phase of EMDR, we install that positive belief.
Mhm.
So it's almost like we're working on the negative belief, we're reprocessing that memory
Mhm.
so it's not so vivid, and then we're installing the positive belief. I am lovable. I
Mhm.
am worthy.
Wow. And you could do that with kids. You could do
Yes.
EMDR with kids. Okay.
Yes,
Wow.
definitely.
Okay.
Yeah.
Okay. Awesome. And so that seems to be a great approach to use then when it comes
Yeah.
to trauma
Yeah. And
work.
what people, and I just thought of this because of what you said
Mm-hmm.
earlier, about having to relive it. In
Mm-hmm.
EMDR, you're not reliving it.
Mm.
It's more like you are on an elevator and I'm with you there.
Mm-hmm.
And we're going to stop at a floor and the door opens and we're looking at what we see and you're
Mm.
explaining it to me.
Mm.
And then we close the doors and we go to the next floor. So
Okay.
I'm there with you the whole time. We're
Mm-hmm.
not reliving it. We're looking at it as an outside viewer.
Okay,
So,
awesome. Thanks for sharing that. That's
yeah.
that's really interesting. And I know a little bit about EMDR.
Yeah.
Um, you know, so it's really neat approach to be
Yeah.
using for sure. Now, when we look at I guess, treatment planning, right? Here
Mm.
it's in the room, you're doing therapy.
Mhm.
What about from like a systems perspective? Like, who should also be part of this process of bringing healing to this child and
Yeah, I think the parents for sure. I When I do therapy with my clients, I like to have the parents involved.
Mhm.
Of course, with the client consent. So I'm always prioritizing my little one that I'm working with. But I'll share with them. Is it okay if I
Mhm.
tell mom and dad we talked about this, and this is how they can help you at home?
Okay.
And they'll say okay most of the time, as long as I'm not sharing something that they shared with me. They're usually okay with it.
Yeah.
So then at the end of the session, I'll call the parents back in and I'll tell them, okay, well, today we talked about compassion. And these are some ways we can practice this at home. Or if it's a grounding exercise,
Mhm.
I'll show the parent what we did so they can practice that too with them at home.
Awesome. And
Hmm.
that way they become an ally to the
Yeah.
therapy process at that point.
Yes. Yes.
You brought up a really good point that a lot of parents and I think as therapists,
Yeah.
we struggle with explaining the confidentiality piece, right? Like some parents are like, "Hey, but they're a minor and I want to
Yes.
know everything that my child is telling me." So,
Yeah.
I mean, it seems like that and you work primarily with children and
Yes.
teens, and so is that something that you come across often and
It is, and I want to have that trust maintained with my
okay.
child, my client.
Yeah.
So it's important that they see me also setting those boundaries with their parents. So I will say to their parent in front of them, well, I want to make sure that our relationship is strong and they can still come to me when they need.
Right.
Um, and I'll ask the client, do you feel comfortable with me sharing? And they'll kind
Mhm.
of make a face. And I'll reflect that feeling like, oh,
Mhm.
you seem uncomfortable with
Mm.
this. You'd rather keep this between us.
Mhm. Mhm.
And the parent usually understands because the whole purpose of them, bringing them to therapy is so that they open up to someone.
Right.
So then
Right.
usually by then they get it and
Yeah.
they'll kind of like, oh, okay, well, this is the
Oh,
process.
okay,
Yeah.
awesome. No, awesome. Yeah, it's something common, right? That we deal with in trying to explain that, and it is for the benefit of the therapy process and overall their healing, right?
Yeah.
Um, when it comes to any other suggestions that you have on how parents can be helpful to the children in this process of
Yes.
healing from abuse?
I think practicing the calming skills, the coping
Mm-hmm.
skills at home with their child when their child is calm
Mm-hmm.
is going to be the best approach. If we're trying to implement belly breathing and the child's like at a level 8 of anger,
Mm-hmm.
it's not going to work, especially
Okay.
if it isn't something that we've practiced all along. So I would say when we notice some minor distress, like a level 2,
Mm-hmm.
that's when we say, hey, well, I notice you're feeling a little anxious. Do you want to sit
Mm-hmm.
with me and maybe we can breathe or we can go on a walk or something to kind of
For
calm them
sure.
down, like normalizing it, you know?
Absolutely. Awesome. Awesome. That's so that system, right? It's parents.
Yeah.
Any other role? Like, what about schools? Do they play any role after a child has been abused or like,
Yes,
okay.
definitely. So thinking back to when I was a school counselor, when a child discloses abuse,
Mm-hmm.
you are a mandated reporter. So
Mm-hmm.
you're going to have to make that report. I usually did that after hours
Mm-hmm.
because again, like the parent, you want to show the child that you're a calm, safe person and we're not going to shame them, we're not going to make them feel any sort of negative way. So after you do that, then you could meet with the parent. You would meet with your AP. It's like a team
Okay.
working together and supporting that parent.
Awesome. Awesome.
Yeah.
So, I mean, I think that makes sense, right?
Yeah.
It's not only just you and the client, but it's you, the client, the school, the
Yes.
household that's a part of this overall healing
Yeah.
process,
I
for
think a
this
lot of
child.
yeah, I
Yeah.
think a lot of parents don't realize that the
Mm.
school is a good ally for them. They can help in so many ways. So,
Right. It sounds like they do have a lot of resources
mhm.
that can help and support. So, speaking on resources, like how does someone find a therapist? Like how do I know who to look for, what to look for in a therapist?
Yeah.
Um,
I like to tell, well, when I was a school counselor, I would like to tell my students, you can shop for a therapist.
Okay, that's a
So
good way
we're
to
going
put it.
online and we're looking
Yeah.
at local therapists and we're reading their bios and we're kind of like, okay, do I feel like they would be a good fit for me?
Mm,
So going through a couple and letting them know like not everyone's gonna be the right fit for you, but we don't give up on therapy because of that. We just need to find the appropriate one.
For sure, for sure.
Yeah.
I know for at least adult clients, I don't know if this is applicable with kids, but typically for adults, I was reading an article. It's about the third or fourth therapist before you actually maybe make
Wow.
a actual
Yes.
connection,
Yeah.
with the therapist. And so,
Yeah.
I would assume it's probably similar, right? And you're
Right.
right. It's finding the right fit for the child
Yeah.
and for the overall the family as well
Yeah.
too. So the trauma, right, is directly impacting the child, right? And after, abuse, and I think we can assume it's also going to impact the family, right?
Yes.
So how should the family, I mean, should they also be in therapy? Should they,
Mhm.
like, what's
Yeah,
yeah.
they definitely can. It's impacting all the members of the family, you're right.
Mhm.
So if that's what the family is needing, it's a great tool for them to use. Sometimes people have the misconception that, well, this didn't happen to me,
Mm,
so I don't need therapy. But
mhm.
it is affecting you and
Right.
it's affecting your daily life. So
Mm.
therapy would be beneficial.
What should I be, on the lookout for, right? Like
Mhm.
if my child disclosed child abuse, I'm seeing the trauma, like
Mhm.
how do I know if I should probably seek help, right?
Yeah. So same things. Maybe we're
Mhm.
having somatic complaints like our stomach is hurting, we're noticing we're more anxious, our head is hurting, we're
Okay.
more fatigued and tired.
Mm,
We feel burnt out.
right.
Um, Same thing as the kids, we're shutting down, we're withdrawing, just a
Yeah.
change in behavior. Probably
Okay.
is a good thing to get some
Awesome.
support.
Awesome. 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 Um, what are some coping strategies, right?
Yeah.
That I mean, I know you mentioned grounding, or there's
Yeah.
some other coping strategies that
Yes.
that are
So
used, or
they use this one in the school a lot, and the
okay.
kids will often complain about belly
Mm-hmm.
breathing, and they'll
Mm-hmm.
say it doesn't work.
Yeah.
And so I'll ask them, "Well, show me what belly breathing is."
Mm-hmm.
And they'll like do and I'm like, "That's
Okay.
not belly
Right,
breathing." So
right.
I'll teach them like we put a hand
Yeah.
on our belly, we put a hand
Mm.
up here, and you
Yeah.
close your eyes, and then you inhale for 4 seconds, hold it, and then exhale through your mouth for 6
Mhm.
seconds.
Mhm.
And I do that with them like a couple of sets, maybe 3 to 4 sets with their eyes closed. And then I'll say, "Open your eyes when you're ready." And they look noticeably calm.
Mm. And that's where you mentioned, like, how, important it is to practice with kids
Yes.
so that they know how to actually do these
Yes.
exercises.
And I
Yeah.
like that one because it's discreet. Like you can do that at your desk and
Mm.
no one will know. If you need to take a break in school, you can ask your teacher, "Can I go to the bathroom?" As you're walking down the hall, you can breathe, take
Nice.
a drink of
Awesome.
water, reset, and go back to class.
Awesome. Awesome. Awesome.
Hmm.
You know, I myself, right, I've worked with kids
Hmm.
in the past, not recent, right? But working with kids, it's tough, and especially after hearing, like, of abuse,
Yeah.
right, that a child goes through. So I have to ask, like, how do you deal with that, right? Like,
Yeah.
and again, I like you hurt as much as you love, and I know you
Yes.
love the
Yeah.
work that you do, and you love your clients, and
Yeah.
and so when you hear a disclosure of child abuse, it's painful,
It
right?
is.
And like, we're not, just because we're therapists doesn't mean like we're immune,
I know.
to
Yes.
those kind of feelings that show up for us. So I mean, how do you deal with that? How do you cope,
Yeah.
as well?
Yeah,
So
you're right. Being a therapist, it doesn't mean those 50, 60 minutes that our emotions are there. And then once that time is up, we're clocked out.
yeah,
Those stay with you and they have an impact. So it is important you take care of yourself,
right.
whether that's walking, going for a run to burn that energy that you're
Hmm.
having, that anxious energy, or doing karaoke. Like there's a ton of different
Yeah,
things I personally
yeah.
like to do
You want to
that
sing
help.
for us?
No,
You want to?
I do that in the
Yeah.
comfort of my car.
Gotcha. 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 Awesome. 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 So, I mean, those are definitely ways, to deal with that, right? And we practice a lot of self-care,
Yeah,
right? Like, that's something that's like pounded in our head in
right.
grad school. Self-care, and we might, when we're in grad school, we don't think much of it, like, "Oh, okay, sure." But
Yeah,
after several
you
years
feel
of
it.
doing this work, you're like,
Yeah,
okay, like, self-care is important, right? We do need
yeah,
those karaoke's,
yeah.
like, moments, right, that show up. So
Yes.
um definitely. And I guess, Kristen, like, what's your again, I think it takes like a special person to work with kids. And I think of my wife, Karen, and her
Mhm.
work with children. She also kind of took a similar route to you. She
Yeah.
became a teacher, she became a school counselor, and now she's a licensed therapist. So
Mhm.
um what would you say is your why, like why you wake up and do this every day and
Yeah.
work with kids? Yeah.
Yeah. I want every child to feel like they can do what they want to do,
Mm,
to have a successful
mm,
life.
mm,
And what that means to them could mean that they're happy,
right.
that they get to be a doctor, that,
Right.
whatever it is to them. I want them to feel like they can do it.
For sure. Yeah, absolutely. And I mean, we know that, the childhood, early childhood, and these childhood years and adolescence, it really does make an impact into adulthood,
Yeah.
right? And so, um, I think that, you know, every parent that notices that there's some sort of issue going on or some concern, that they go ahead and take care of it now, right?
Yes.
Um, Last week actually there was a we had a client come into one of our clinics, and just a number of issues that were going on. And one of the first questions were, right, is okay, what who have they seen for treatment? Because
Mm-hmm.
I mean, with everything that's been going on,
Yeah.
including some psychosis that was happening as well
Wow.
too,
Yes.
zero. Zero
Wow.
history of ever seeing any mental health professional of any kind, zero history of seeing a psychiatrist. And so that leads me to think just the taboo it
Yes.
still exists,
Yeah.
right? In mental health, like it's taken this long for you to come in now to this point. And so I
Right.
don't know if you can comment anything on that, on just the stigma surrounding
Yeah.
mental health and just
Yeah.
seeking help,
There is a
right?
lot of stigma, and we see that in certain cultures more than others. But I do feel that more and more people are coming to
Hmm.
therapy, which is a good thing. And the fact that they came to the clinic finally,
Yeah,
that's a good step
for sure.
forward. But yes,
Yeah.
by coming to therapy when they're young, it's preventative care. You're helping them now so they can be successful in the future.
Right, right. I like that word, preventative care. I
Yeah.
think I think you're right. That is what it's about. It's about, being able to help the child early on so that we
Mm-hmm.
don't have these long-term effects, right? And
Right.
impact for them. Yeah, that case was something different. I really hadn't heard with the just the level of severity and stuff, but
Yeah.
I think what also happens is that people don't want it to be real, right? And so
Yes.
like if I don't take my child to therapy, then it's sort of living in this delusion that it's not really happening,
Yeah.
right?
Yeah.
But I think just that's probably the worst thing that you can do. It's
Right.
yeah, just
Yeah.
the long-term impact that
I
that will
think
make.
that fear of that parent holds them
Hmm.
back from seeking care.
Yeah.
And sometimes when working with the kids, I'll have to, work with the
Hmm.
parent too and
Yeah.
help them.
I'm sure that there's so many cases, Kristen, that there's been child abuse
Hmm.
and it's just never been reported,
Right.
right? I know of cases where I see adult clients that share with me, I disclosed this to my mother, my father, and their response was actually anger
Yeah.
and almost like blaming them for the actual abuse. And
Yeah.
so what would we, how could we handle those moments? Or like what would we say to a parent who maybe is aware and
Hmm.
knows like, yeah, my child was a victim but I haven't done anything about it?
Yeah. So there's some shame with that parent too.
Mm,
And maybe they didn't know the appropriate steps to take.
right.
I've had a similar case like that too, where the
Mm,
mom wasn't sure what to do after her
mm,
daughter disclosed abuse. And she went into the school. It always goes back to the school.
mm-hmm,
And she sat with the school counselor and just poured her heart out and just
mm.
cried. And the school counselor was able to help her.
That's awesome. Yeah,
So I think parents being able to have the courage to come forward themselves is going to help them and their child.
for
And
sure.
finding a person, it could be someone in the school,
Mm-hmm.
a therapist, anyone, just to get those resources
Yeah.
and get their child started with therapy.
For sure. Yeah, that school seems to be just the front line. I
Yeah.
mean, in really getting to know like what's happening, right, with
Mhm.
with these children. So, um, I guess what would that be a message that we can share with overall with parents that have children that have been abused and they're struggling with some of that shame and just,
Yeah.
I don't know what to do with this feeling. Like
Yeah.
I feel guilty. I feel like it's my fault because that's
Exactly.
common, right,
That's
as
very
well too
common.
that we see. And
Yeah.
so,
I would just say to the parent, to the child, this is not your fault.
mm, mm,
This wasn't because of you. It's not your shame to carry.
mm,
And to find a therapist that they can connect with so they can share all of these negative beliefs and
for
thoughts
sure.
and get some help.
Yeah, absolutely. So what are some other resources that are out there,
Yeah.
for victims
So,
and
right, right. So, when that parent does come forward and share with the school, this has happened to my child, the school will typically help that
Mhm.
family in need and they'll offer a program that's called TChat.
Okay.
And that's done through the University of Texas, and it's telehealth.
Mhm.
The child can actually participate in virtual therapy
Oh,
at school or in the comfort of their own home.
okay.
So that's been very beneficial in helping families, and it's no cost at all.
Okay.
So,
No cost at all to them, so it's a free
free
resource for them.
resource.
That's
Yeah, I
amazing.
think they offer about 4 to 6 sessions that are free, and then they'll refer out to local therapists in their area. And what I like about them is they don't just, okay, we're done, go find a therapist. They'll put together some resources and they'll provide that to the family.
So they'll do a proper like handoff as well too
Yes,
to the next
yes.
therapist. Okay.
The other thing they have for kids that have been through something
Mhm.
traumatic, they have the UT Trauma Clinic, and we actually
Mm.
have one downtown.
Oh wow.
So, yes, the kids here that are local, if they've been through something like that, they also get, I think, 8 to 12 sessions over there
As
for
well
free.
too. So
Mm-hmm.
there are resources out there that, that parents can take advantage of,
Yes.
for
Mm-hmm.
these children that
Mm-hmm.
have experienced this. Um you mentioned virtual therapy, right? And again, just
Mm-hmm.
thinking as a parent, right? Like I think some parents feel a certain way about doing virtual
Yeah.
therapy. Like, I mean, I don't know what your thoughts are on ages that might be
Yeah.
appropriate for virtual therapy or not, or how
Yeah,
do you even
that's
keep a child and get what does that look
right,
like?
right.
Yeah.
So for virtual therapy, it is going to depend on the age of the child. I mean, if they're
Hmm.
4 years old, we can't expect them to sit still for 50 minutes.
Yeah.
I would keep that in mind, the age of the child, and also how they do with online
Hmm.
therapy. Maybe try it out for the first session. And if it isn't a good fit, then ask for something in person.
Hmm.
A lot of therapists like myself, we like to use platforms where kids can engage in games and it's
Okay.
actually like a virtual playroom. So
Hmm.
it's comfortable for the kids.
Okay. Oh, neat.
Yeah.
So they're actually like engaging throughout. It's not just looking at each other on a
Yes, it's
screen,
not
but
awkward looking
okay.
at each
Okay.
other. Yeah, it's a virtual
Gotcha.
playroom. There's games, there's board
Okay.
games in there, there's feeling charts, there's lessons in there,
Okay.
videos. It's
Awesome.
awesome. Yeah, it's a
Awesome.
good
That is great. I
resource.
mean, at the end of the day, it's about getting help and meeting people where they're at, and they can't drive out there. Hey, there's another
Right.
option. Let's do something
Yeah.
about it,
Yeah.
that we can do, right?
Mhm.
Any other resources that are local um, that you would recommend or?
Yes. So earlier I talked about the nonprofit
Mm-hmm.
organization that's called Sci Hope, and it's here
Okay.
in Cyprus.
Awesome.
Schools will also partner with them, and they'll provide holiday assistance, or what they do for families in need
Mm-hmm.
is offer Backpack Buddy.
Okay.
And so each Friday, families that are in need will get a weekend supply of food
Oh
to take home.
wow, wow, wow!
Hmm.
And that's through Sci Hope.
Yes.
That's the name, Sci Hope.
Yes.
Okay,
Yeah.
awesome.
Sci Hope.
Wow, wow. Okay, so again, there's so many resources out there,
Yeah.
right? And I think a lot of it comes down to just ignorance and not knowing that
Yeah.
this even exists,
Right,
right?
right.
And so I'm glad that we're having this opportunity to talk about this and just share the information, right? to a family that, again, maybe they didn't know, and now they have
Right.
that opportunity to know what's out there,
Yeah, that's
for
true
them.
because I mean, doing a Google search, we're not going to find these resources.
Right,
So it is
right,
important, to talk to your school and try to find these resources.
for
It's
sure.
going to take courage for that parent to come
Hmm.
forward too.
Absolutely, absolutely. When we talk more about reporting, I think parents, right? There's this fear that
Yeah.
shows up for them,
Yeah.
right? And what, some of those fears, I mean, that I've just concluded, right, based on
Yeah.
what I've seen, and please share your thoughts on this, but it seems like they feel like they themselves would get in trouble for, like, disclosing, and I think that comes from, like, oh my gosh, I didn't protect my child,
Yes.
and
Yeah.
now I'm having to report this abuse,
Right.
right?
It's heartbreaking for parents because they do take it on themselves and they do feel like it is their fault.
Hmm.
And it's not.
Right.
So yeah, I do think therapy would help in
Yeah.
cases like that to help unload those
Right.
heavy feelings and those negative beliefs.
For sure, for sure. Yeah, this topic, of child abuse is, it's unfortunately it's very popular, right?
Right.
And we hear, like, things like, Epstein files,
Oh my
and
gosh,
all of that
yes.
stuff that's
Yeah.
that's just going on right now. And
Yeah.
so, like, it's happening, right? But I think we, because of how painful it is, even, again, once again, me even thinking about the fact that there's a child out there right now
Yeah.
that hasn't gotten help, like, that's tough,
Right.
and I think it's so painful that we rather kind of look
The other
away,
way.
right? But
Yes.
how do we become advocates, right?
Yeah.
Like, how do we, be able to, say, like, hey, we got to talk more about this, and
Mhm.
as a society, kind of coming together. And I know the Children's Advocacy Center is
Mhm.
another great resource, and
Yeah.
there's a lot of locations there. But
Yeah.
yeah, how would someone that maybe has no necessarily ties, right, to
Right.
that, but wants to help in some way? I mean,
Yeah.
anything like
So
that?
I'm thinking when you describe this as like a witness or bystander, and I
Hmm.
think if we notice something, say something.
Right.
There's the abuse hotline that you can easily program into your phone.
Okay, for
And if
sure.
you notice something is off with a kid
Hmm.
at HEB or whatever store you're at,
For sure.
then
Yeah.
call and report it because it's better to help
Yeah.
and be safe.
Right, for sure. We've mentioned so far neglect, and
Right.
we mentioned sexual abuse,
Yeah.
right? Um, there are other types of abuse as
Mm-hmm.
well too. And so, what other types of abuse are there that?
Yeah, there's neglect, there's
Hmm.
sexual, physical, and then emotional.
Yeah.
And emotional hits pretty hard for me because I think some parents aren't aware
Mm.
of emotional abuse and we're so hard on our kids because we want them to succeed, but at what cost?
Mm.
How is
Okay.
their criticism coming across to that kid? Their voice becomes the child's inner voice. So
Mm.
I think that's definitely something we need to be more aware
What's
of.
what what's like an example of what emotional abuse may look like
Yeah.
maybe a specific phrase, or what does that
Yeah.
even
Maybe
sound
like
like?
you never do anything right.
Hmm.
That to the child feels like, why? What's the point of trying? I don't ever do anything right.
Mm. Mm. Okay. Yeah. What other examples could there be, with
Hmm.
that topic of emotional abuse?
Maybe telling the child they're bad.
Hmm.
They made
Yeah.
a bad choice, but that doesn't mean they're bad.
Right.
And when we say those words
Mm.
and the child believes them,
Yeah.
that's become one of their
Right.
core
For
beliefs.
sure. So that's what it's about. It's an attack at their core, at
Yes.
who they are, their
Yes.
personality,
Right.
and yeah,
We're
yeah.
shaping these kids and
Mm.
we want to make sure that we're checking our own emotions
Yeah.
before we have to
Mm.
help our child with their emotions.
For sure, for sure, absolutely. And so, okay, so we've got neglect, we've
Hmm.
got physical, and we've got emotional
And
abuse,
mhm.
right? Any other types of abuse that that we've seen in children,
I
or?
think those are the main ones, the
Mm-hmm.
physical, the sexual neglect,
Mm-hmm.
and emotional.
Okay,
Yeah.
okay. I've also heard some other forms of abuse. I don't know if you've
Okay.
seen it, right? I
Yeah,
see it
yeah.
mainly in domestic violence
Oh, right,
situations,
right.
right? So I'm not sure how applicable this would be, but
Yeah.
definitely religious or spiritual
Oh,
abuse
yes.
and that
Yes.
type of stuff. And so I'm sure that kind of overlaps with
Mhm.
the emotional
Some of them
abuse
do overlap,
that
yeah.
show up. What about, how does culture play a role in child abuse?
Yeah,
What comes to
so
mind?
with cultural, sometimes we have those norms that we grew up with,
Mhm.
and the parent trying to raise their child with those norms,
Okay.
sometimes it can overlap into emotional
Okay.
abuse and make the child sort of question their own identity. Like, well,
Mm.
I don't want to be a part of this culture if
Right.
this is going to happen.
Mm. Mm. And we can, us being, in the Latin American community, right? Being
Hmm.
Hispanic and stuff, we see that.
Yeah,
And again, just mental health is already taboo enough, and then we have now a child being abused. There's more stigma that's
right.
surrounding that. So, um, at least for me, right, emotions. I think I would say my parents did a great job at like
Yeah.
touching on emotions, and but you would hear those comments like, oh, like it's like going to a psychologist, like estás loco,
It's for the
right? Like it's
crazies.
for the
Yes.
crazies. And so you do hear that. It's
I would
common. And
argue that it's to stop us from being crazies because we
mm,
learn how to
that's
regulate
true.
our
Yeah, for
emotions.
sure.
Yeah.
Absolutely, absolutely. Or yeah. Otherwise, yeah. My family will say that, instead of calling me like psychotherapist, is viene el psicoloco. So it's, even me in this profession, like that's still,
Yeah.
the sort of the comments
Yeah.
that are made. So
I
yeah.
like to think that my mom has also grown from her
Mm,
view because now whenever she sees our videos that we post about mental health,
yeah.
she's like applauding
Oh, there
them
you
and
go.
sharing
That's
them
my
with
girl.
family
That's my
members and
girl,
I'm
right?
like, "Wait."
That's awesome.
Yeah.
Yeah. Yeah. I think, you and I, and, we all have our stories, right, that lead us into the mental health field. And, we do this again for the love of it and for our own background, that just has taken us, to this path. And, um, I think at some point, every psychology student or therapist, the majority, right, they seek their own healing, right,
Yeah.
and they go into the helping profession, right.
Yeah.
And so I think it's always neat, our being a therapist, right, because
Yeah.
we're human. We've
Yes.
gone through our own issues, our own things that have led us to helping others,
Mhm.
and so I think it's a neat storyline, right? To
Yes.
kind of be where we're at, sitting here, and we help people for a living,
Right.
and that's just extremely
It
rewarding.
is.
So
Yes.
it's awesome. Any other thoughts or comments, Kristen, or that come to
Just
mind?
touching
Yeah,
on that, I think that's what also helps us to be a good therapist for our clients is, we have endured something, so it helps us to have compassion for them.
yeah, for sure, for sure. Are you currently accepting new clients?
Yes.
You are, okay, okay.
I have
Well,
to
I
think
mean,
about it. I'm like, "Oh, it's already
you're like,
January, so
maybe
I think I
that.
am."
Okay, awesome, awesome.
Yes.
Yeah, no, I mean, I see your schedule, and you're
Yeah.
booked out, and at some point at the treehouse, we had a waiting list. I think we still do. We still have a wait list.
Yeah.
So, um, absolutely. I think, knowing that there's other resources out there is awesome. We have the Treehouse,
Mhm.
Sci Hope. There's other practices in the area that I know they're accepting clients. And like you said, it's about making a phone call, trying to connect, and reach out for help. Um,
Yeah.
for our office, we try to never turn anyone away
Right.
over finances, and that's
Right.
another thing I would say
A
to people.
barrier.
It is a barrier. Is to, when you call, tell them about your financial situation.
Yes.
Like, therapists are compassionate. Like, we'll work with you, we'll
Right?
figure out something that's gonna help you and your family.
Yeah, I
Yeah,
love that our office does that. Like our
yeah,
care coordinators, they recognize when somebody does need help
for
and they'll
sure.
definitely meet them halfway. Another thing that we do is the 15-minute consultation where
Yeah,
you can call and kind of get a feel for this therapist and what their plan would be
for
moving
sure.
forward.
Yeah, yeah, that's a great point. And a lot of places do that, the
Hmm.
15-minute consultation, and also gives the therapist an opportunity to say to really say, "Can I help
Can
this
I?
client?"
Yes. Yeah.
And so definitely taking advantage of those 15-minute free
Right.
consultations
Yeah.
is great. Is great. Awesome, Kristen. Well, Kristen, thank you so much for being here, for the opportunity to talk to you. It's an honor to have you, today. And so I hope
Yes.
that this isn't the last time, and that you
Of
definitely
course.
come back
Yes.
again.
Yes.
So
Thank you so much for
awesome.
having me.
Yes, absolutely. Awesome.